Today I'll be dealing with how to rehabilitate a patient who has already lost sight in an eye, either due to trauma, tumors, or more increasingly we are seeing patients who have lost sight due to after surgeries. So whenever we do evisceration or enucleation, we put in an implant to replace a lost volume and then put an artificial eye over it. So artificial eye is also called a prosthesis. It can either be a ready-made artificial eye or a stock eye, or it can be a custom-made one. Ready-made artificial eyes are easily cheap and available, and it can even color match to the other eye. But in the long run, because of the coupling between the posterior surface of the stock eye is not congruent to the surface of the socket. It produces greater irritation and discharge, and consequently socket contracture in the long run. Here you can see the difference the custom artificial eye has made to this patient. So I'll show a short video. There's an audio also.
Ocularistry is the fascinating craft of fabricating and fitting an artificial eye. This young man who was depressed from losing vision in one eye is worried about his cosmetic appearance. Alginate, which is an irreversible collide, is used for the impression. An acrylic tray with a hollow stem is placed in the eye cavity. Alginate material is syringed through the stem to get an impression of the socket. As alginate sets, the impression is removed from the eye cavity. The lid alignment, ocular movements, and the frontal projection is compared with the other eye. Red-colored nylon threads give the look of the vessels of the sclera. Sclera is then painted with the appropriate tints to match the other eye. Now, upper part of the eye is being marked. The prosthesis is framed and polished. And is now ready to wear. Patient is instructed on its insertion and removal and reviewed after 1 month to assess the wearer comfort.
That's the cosmetic
പിള്ളേർ തമ്മിൽ കളിച്ചിട്ട് കോഴി കൊണ്ട് ഒരു കുട്ടി എറിഞ്ഞ് നമ്മളെ അവിടെ എറിഞ്ഞ് ആക്സിഡൻറ്റ് സംഭവിച്ചപ്പോൾ തന്നെ ഇവിടെ LF കൊണ്ടുവരും. പിന്നെ ഡോക്ടർ സർജറി ചെയ്തു. കാഴ്ചയ്ക്ക് നോക്കുമ്പോൾ ആദ്യം കുഴപ്പമില്ലായിരുന്നു. പിന്നെ സ്റ്റിച്ചൊക്കെ എടുത്തു കഴിഞ്ഞപ്പോഴത്തേക്കും കണ്ണ് ശരിക്കും ചുങ്ങി ആദ്യത്തെ വലിപ്പത്തിലും ചെറുതായിരുന്നു. കോണ്ടാക്ട് ലെൻസ് വെച്ചപ്പോൾ അവന് നമുക്ക് പെട്ടെന്ന് എടുത്തറിയുമായിരുന്നു കണ്ണിന് ആക്സിഡൻറ്റ് പറ്റിയ കണ്ണാണ്, കോണ്ടാക്ട് ലെൻസ് വെച്ചിരിക്കുകയാണെന്ന് അറിയായിരുന്നു. ഇത് വെച്ചതിന് ശേഷം നല്ല ഇമ്പ്രൂവ്മെൻ്റ് ഉണ്ട്. ശരിക്കും നല്ല മൂവ്മെൻ്റ് ഉണ്ട്. മാനസികമായിട്ട് നല്ല ഇമ്പ്രൂവ്മെൻ്റ് ഉണ്ട്. പഠിക്കാനും ഇപ്പോൾ ആദ്യത്തേലൊക്കെ നല്ല കഴിഞ്ഞ വർഷങ്ങളിലൊക്കെ വെച്ച് നല്ല മാർക്കുണ്ട്. കുഴപ്പമില്ല, നല്ല ഹാപ്പി ആയിരുന്നു.
In Kerala, marks are important. So even after fitting good custom artificial eye and with the best of implants at this stage, you cannot get movements in the extremes of gaze. You can get only movements within 20 degrees of the primary position, that is in the conversational range. And the lid should close normally over the artificial eye to prevent dry eye. And in young children, once you explain to them the procedure, and even you can demonstrate in older patients, they are very cooperative in taking an impression. But in very young children, you may have to give a short GA because the head has to be kept steady. And we'll go through some of the patients where we had given a custom artificial eye. This was a case of retinoblastoma. Always give protective glasses for one-eyed people. In any staphyloma, anterior staphyloma, ciliary staphyloma, it's ideal to do an evisceration with implant and then give a custom artificial eye after 6 weeks. When there is volume and socket contracture, that is when the conjunctiva is contracted, when the fornices are shallow, you have to replace the volume and the surface. The surface is replaced with dermis and the volume with fat. It can be taken either from the thigh or the buttocks. When an adult patient presents with anophthalmos, you may have to do a socket reconstruction with mucous membrane graft and then place an artificial eye. In such cases, you may not get any movement. You are lucky if you can place an artificial eye in the socket. When a child presents with congenital anophthalmos or microphthalmos, you can progressively increase the size of the socket by increasing the size of the conformer, and by the time the child goes to school, you can give a good custom artificial eye. You see how the conformer sits so comfortably over the microphthalmic eye. When the conformer starts to rotate in the socket, it's time to increase its size. This happens once in 3 or 4 months. Sometimes you may have to do ptosis surgery or medial or lateral canthoplasties to increase the size of the palpebral aperture. Ptosis prop on the artificial eye can increase the lid height to a certain level, but sometimes you may have to do a levator resection over it. We have found that older patients are more particular in getting a good custom artificial eye than younger patients, and sometimes we had to paint lower lid onto the artificial eye, sometimes pterygia, and in this case larger than normal cornea was painted to match with the other eye. In cases where slight microphthalmos and who are nearly blind, you can enhance the appearance with cosmetics alone. You may not be able to fabricate a custom artificial eye over this cornea, and we didn't want to do any enucleation or anything. Anyway, the appearance will be like this only. With this, we are glad to make a change in the lives of some of these patients. And but remember, at work, let me thank Shiji, our prosthetist, who is a perfectionist, and our sisters. But remember that behind every successful woman, just like Dr. Meena said, there is not only a man and his parents, but also an efficient help to whom I have outsourced all my kitchen work. Thank you.